You're listening to the Sisterhood of Limitless Living podcast. I'm your host, Dr. April Moreno. I'm a public health specialist focused on integrative wellness and autoimmune living, supporting the community of women, where I help you to live your best quality of life through being your best self-advocate. Let's get started. Hello, Sisterhood. I hope you're enjoying the holiday season. As we're in the beginning of December now, I hope you enjoyed the Thanksgiving weekend. I do love the fact that it is basically a 4-day weekend here, and I did my best to try to relax and focus on rest versus getting involved in my various projects. And I think I did pretty well with that. I did some relaxing and time with family here in my little house with my little family. We basically just ordered food from the store, had it already made, and we just celebrated in that way so that we wouldn't have to worry too much about washing dishes as we usually do, cooking, cleaning. Usually it involves cleaning first, then cooking, and then cleaning again in our house as it is. So it was pretty relaxing, and we are the Multicultural podcast for autoimmune women thriving, and I do want to recognize that Thanksgiving is not the Thanksgiving that we read in our textbooks in elementary school. It's not as simple as that. There's definitely complexity to the Thanksgiving experience, and so I just want to give special recognition to the Native American population, various communities in North America who do not experience the same textbook story that we hear. And I do want to give special recognition and acknowledgement as we acknowledge their experiences here as we live on colonized land. And I do want to give special attention to the fact that I am on Kumeyaay land here in San Diego as we talk about Thanksgiving. And Thanksgiving is a little complex, right? And I do see it definitely as more of a family time of gathering versus hey, we just landed here on this place, on this huge continent and so on. Some of us actually are still in some way, in some extent, indigenous to the Americas. And so I do want to acknowledge the complexity of the holiday and how the textbook version is very different from the version that many of us experience with family. And then this year with the pandemic, realizing that it's not safe to gather in groups. And so here we do our best to isolate. We pretty much practiced the shutdown culture, the shutdown practices for most of this entire year because of the fact that I am part of the immunocompromised community, and I'm just so much more acutely aware of epidemiology, pandemic spread, and disease prevention. Being from the public health field, I just tend to be extra vigilant. And so we've been shutting down the entire year, to be honest. And so here for Thanksgiving, we just stayed home and celebrated remotely by phone and said hi to everybody by phone. For Christmas, we'll probably do something where we meet in a public space at a park with masks, and we just kind of plan to do a quick interaction of gift exchange and then head out on our way completely with a mask and completely outdoors with social distancing, even with family. So that is the plan here. Again, I just completely do celebrate the holidays this year from a sense of shutdown in terms of the pandemic and disease prevention, disease control during COVID-19. And I am so excited, though, about the fact that we might be part of the first group in the immunocompromised population. We're part of the first groups that might be able to receive the vaccine for COVID-19. And I am excited about that because if it does work, and I suspect it's going to be possibly something like the flu, where it's just like definite reduction of risk. I will continue to wear a mask either way, but it just could be so freeing to know that there's a vaccine out there and to know that we have that protection as much as we do with other diseases. So I am very excited about that possibility for sure. And until then, we are going to continue here as if we're in the lockdown circumstances as we've been doing for most of this year, ordering food by delivery or going into supermarkets once a week where it's super quiet and isolated during those hours. So today we're going to be speaking to Dr. Micaela Bayard, and I'm really excited in this interview because we're speaking to a rheumatologist who works with rheumatological diseases, of course, lupus, Sjogren's, and so on. And she's going to be sharing her experiences with us about the importance of community, how she helps out with helping with health disparities and speaking with and serving diverse communities of color as well in this lupus and rheumatological journey. She talks about the importance of support and support groups. And I'm really excited to share this conversation with you today. Before that, I do want to share with you the fact that we do have an event coming up in January. It is called the Multicultural Integrative Wellness Workshop. As you know, this podcast is the Multicultural podcast for autoimmune women thriving. My work is very much centered on diversity because it's a diverse world. It's just, to me, it's basically very natural that we look at diversity and we promote and we celebrate and we appreciate diversity in our cultures around the world and here in the United States, for example. So in January, I'll be leading our second Multicultural Integrative Wellness Workshop. This workshop took place earlier this year, and it was met with lots of wonderful response, wonderful reviews, as we met in person here in San Diego at the time. This time it's going to be online and actually going to be a little bit longer than it was back then, as based on comments that they wanted more in-depth information about the various dimensions of wellness and how culture interacts and influences what we perceive in different ways and decisions we make and the support that we have in our communities. So this is going to be taking place in January. The wait list is actually open now until December the 12th. And if you're interested in learning more, please visit aprilmorenophd.com/workshops. So this is the Multicultural Integrative Wellness Workshop, and it's going to be online. It includes a workbook that you can continue to plan throughout the year. What people really enjoyed about the workshop is that it was very helpful for them to see the big picture of wellness. They believed that this was a great way to see, hearing about the experience of multicultural aspects they had not really thought about too much in the past. This person says, I developed a much deeper meaning to deeper dimensions of wellness. Another person said, I learned about different life experiences, how they connect to wellness. And then someone else said, I learned to listen to my body through this workshop and see what works best for me. So it's really about how multicultural experiences influence the way you make decisions about your mind, body, spirit, and environment for 2021. So please join us for the Multicultural Integrative Wellness Workshop. If you sign up for the wait list by December 12th, you will receive a $20 discount on the registration at aprilmorenophd.com/workshops. Thank you so much for joining us here on the Sisterhood of Limitless Living podcast. Today, we have a special episode where we're going to be speaking with a rheumatologist in the United States on the East Coast who works with women, who is very interested in the multicultural community. And today I introduce to you Dr. Micaela Bayard. She is a rheumatologist in New York, and she's particularly interested in the theme of discussing, women of color and lupus and rheumatological conditions. Welcome, Dr. Bayard.
Thank you so much for having me, Dr. Moreno. I'm just excited to chat more and foster this conversation.
Me too.
So I am coming from New York. I practice predominantly in Queens. I have I've been doing this for 3 years, but did most of my training in New York. And funny story is I didn't know that I wanted to work in rheumatology or with patients with rheumatic disease and autoimmune disease. But what became so evident to me when I was training was how complicated and how much support that community could benefit from, and how many women of color I came into contact with, and how much that meant to the patient population to see a physician of color. And I think that it really sparked my interest in continuing to work with the community, and I'm just excited to share with the community today because they've given me so much. I've learned so much, and really I see my role as a rheumatologist and as a provider is to really foster connections between people, because outside of the medicine, there's so many ways people grow and treat their conditions and their diagnoses. And I think so much of it comes from the community that they can build. So I work at Mount Sinai, and we basically have a lupus support group where it's been a little different with the pandemic, but we really would come together once a month and have speakers and topic discussions. One, to educate each other and learn more, but also to share each other's experiences. And so I'm excited to be here today.
So please tell us a little bit more about how you got started in rheumatology. How did it, when you were in medical school, how did it kind of head into this direction?
Great question. I think, there's two types of medical students. There's people who have known since they were 5 exactly what type of physician they wanted to be, and I wasn't that person. I knew that I liked long-term relationships, and I wanted to build a longitudinal relationship with most of my patients. And throughout my training, I initially thought I wanted to be in primary care, but as I practiced and realized and was exposed to actually a Black rheumatologist when I was in training, I really saw how complex the conditions she was treating were, and the possibility for really forming long-standing relationships with the patients. And I think that was the aspect I liked about primary care, but it was a new window into thinking about diet and exercise and alternative medicine, and how all of these things can impact diseases we're still learning so much about. So I think that it was sparked by being exposed to a great mentor, but then really took off when I saw how much possibility there was, to still learn and grow in the rheumatology field.
Can you tell us, over the years, as you've been working with rheumatology patients, what have been some of the most interesting trends that you've noticed? First, like in general, and then in the lupus community.
Yeah, well, I think, it's one of the few statistics I quote, and this is true for most autoimmune diseases, but for lupus, the diagnosis really lags behind the symptoms presentation. And for many people, that's as long as 6 years. That's an average reported statistic. So for me, that is something that's really important to me. And I think why it's so important that we really not just educate people who've been diagnosed, but really spread awareness within the communities, because many of the symptoms can get overlooked and can be misdiagnosed or, put off as symptoms that, aren't that important. And so for me, that one statistic of really being able to figure out how can we cut down that time from symptom start to diagnosis and prevent the damage that occurs in that time period has been, a really important piece for me. And I guess we'll be talking about it later, but I'm really trying to build awareness on social media about what are the common symptoms and kind of demystify this lupus word and autoimmune disease, and really to empower people to take the initiative to challenge their healthcare providers to think more about what may be causing, common symptoms like fatigue, poor appetite, joint pains, and muscle aches, because sometimes those simple symptoms can be the key into thinking more about autoimmune disease.
Mm-hmm. I love the fact that you mentioned this need to connect the symptom to the diagnosis a lot sooner. and noticing those trends, how it takes so long for a lupus patient to get that diagnosis in many cases. Can you tell us any trends that you've seen out there in terms of the, like we talked about, the social determinants of health and health
Mm-hmm.
disparities? And when we look at patients of color, minority patients, what have you been noticing out there in terms of what the health needs are, what the health condition has been looking like, prognosis, and so on?
It's a very complex question. I guess I would start with just thinking about the health condition. I think many people are so aware of their health and so in tune with their health that they really know something, may be off or isn't right, and really just need the tools and the healthcare providers who can support them in trying to evaluate what's happening, and the right healthcare facilities where they can really feel comfortable asking those questions. And I say it to my patients all the time that, even if we're not a fit, you should keep looking for a rheumatologist and a primary care provider who can really, that you feel comfortable with, that you can voice questions with, that you can easily contact. So I think that for me, a big piece of the disparity in this diagnosis and then why we're seeing it more in the community of color is because we need more healthcare providers who are caring for communities of color and also who are thinking about the health conditions that impact us more.
Mm-hmm.
I can't speak for what the social determinants of health truly are, because I think it's a research area that's lacking, and we've chatted about this, but I think that we know the disparities are there, and we have to really understand the communities that we're in and why those exist. Are people not accessing care, or do they not have access to care? We know with lupus and autoimmune disease that environment and stress plays a huge role potentially in development of more severe symptoms. So we really need to understand more about people's work conditions, people's, food access, people's housing situations, and how that impacts people's stress and environment, and start to look at those pieces when we think about diagnosis.
I guess I'm really curious to hear about some of the most recent treatments that are out there when it comes to lupus. I've heard various stories about how the disease treatment, the science of that has been a little slower compared to other autoimmune diseases. As a researcher, we've looked at multiple sclerosis, and they're up to like 14 different disease-modifying drugs out there. I'm really curious to hear what that looks like in the lupus community. What types of treatments are out there right now?
Yeah, it's a great question. There's a lot of crossover in the different autoimmune medication treatments. For lupus, some of the medications haven't changed. And although there have been large clinical trials, really belimumab or Benlysta is one of the few medications that is approved solely for lupus that has truly come out in the past 10 years in terms of, solely lupus treatments. So drug development for lupus populations is really important. And some major foundations are really trying to work to recruit very diverse populations for the existing studies being done, because we really need to make sure that the treatments are representative for everyone. I think that as we move into more personalized medicine, we're going to start to see that different communities may respond to different medications differently.
Mm-hmm.
But I think just unfortunately, lupus has not been an autoimmune disease where there's been major advancements in drug development. So we do use drug-modifying anti-rheumatic drugs, and Benlysta or belimumab, which is a monoclonal antibody, and the newer medication I discussed is a treatment that was initially studied for people without any organ involvement in lupus, so musculoskeletal symptoms, and more recently has had some success in lupus nephritis trials. There has been some movement towards development, but we definitely need a lot more clinical trials in lupus medications.
I'm really curious. We talk about, there's COVID going on right now. There's been a lot of talk about that particular medication, hydroxychloroquine. I am really curious to hear what that's been looking like for your patient.
Hydroxychloroquine, it's so interesting that it was considered a medication for treatment. For me personally, as a prescriber, it just became extremely difficult for patients to have access to hydroxychloroquine or Plaquenil, and is one of the few medications, although it's been around for a very long time, that we have little concern about significant side effects, and it actually can make significant impacts on people's symptoms, and has been actually shown to have a preventive effect on down the line symptoms and damage, which is pretty extraordinary. So during the pandemic, access to Plaquenil was really a very scary time for patients. And major foundations, including the Lupus Foundation, were doing a lot of work behind the scenes to make sure patients maintained access. But I definitely had patients who went without these medications they'd been on for 20 years, 15 years, for a few months until we were able to regain access. And really, it just is such a unique medication for lupus treatment that it is hard to replace it.
At the moment, it's is it more accessible? Is it more available now?
Yes, so luckily there's actually been some mandates made that when prescribing hydroxychloroquine, you have to state the diagnosis, which has put a cap on some of the other, diagnoses that it was being prescribed for, which really led to the difficulty in accessing it. And so it's definitely improved in terms of access. And, I think it's helped that we have some preliminary studies that are showing that it's not beneficial for people with COVID. So it's not really something people are experimentally using as much as they were at the beginning of the pandemic.
Curious to hear about multiple diagnoses in the community that you serve, your patient population. Are you seeing that they have more than one autoimmune disease diagnosis?
It's a good question. I think that I don't know exact statistics. People definitely do have, I have patients that have multiple autoimmune diagnoses. It can be tough to make that diagnosis. As you may know, mixed connective tissue disease is an autoimmune entity where people have features of multiple autoimmune syndromes, and lupus can be one of them. And actually, very commonly in lupus, people can have Sjogren's symptoms, so dry eyes and dry mouth. And we really don't call it an overlap, but it can be part of the lupus condition. I think that the co-diagnoses I see most frequently are actually lupus and fibromyalgia, which is not an autoimmune condition, but a condition that can really impact people's energy levels and function. And that's something I think a lot about when I'm treating people with autoimmune disease.
I would love to hear what advice you can provide to somebody who is really struggling, whether they maybe suspect it's lupus, maybe, it's something that they have in their family, relatives with, I have cousins with lupus, I have relatives with lupus, whether someone who's going through some difficult health challenges and maybe not yet diagnosed, or someone who is newly diagnosed and just kind of going through the toughest times. I love this question that I like to ask in this podcast for those who are listening, who are really struggling right now. How can we encourage them? What kinds of advice can we provide to somebody who's really having a hard time with their health?
I always see people's strengths come out of community, and everyone defines that so differently. It may be that you have a primary care provider that you connect to very closely, but it can be so many other forms of community, your church community, your family community, your neighborhood community. And I think that strength can come from really being open about your diagnosis and seeing who else is experiencing it, because there's such a wealth of resources in the communities we have, and sometimes we don't share that information. So I really love when my patients get to a point that they feel comfortable sharing with other people about their own experience, because they can speak so much more strongly for, support system than I can, because they've experienced it themselves. But I think that we do have lots of great foundations that are doing a lot of work to bring people together, particularly the Lupus Foundation of America, as well as the Lupus Research Alliance. And they really have great networks in many major cities that hold support group meetings, that holds events. And of course, everything is changing to a virtual platform now, but I think that can be a great place to start for many people. And they also are a wealth of information about providers that really feel passionate about providing more than just appointments and medication administration for their patients.
Yeah, I agree with you. The power of community is so powerful. It's everything, in my opinion. Just through this autoimmune journey over the past few years, it's really the friends I've made through various community organizations or networks, and the friends who are really getting through this with a lot of strength that are really, they help me so much. The people who have the courage, the faith, and the strength are the people that I spend my time with, and I think it just helps me to survive, and also helps me to thrive and help other people.
Yeah, and I don't think, my experience is in the lupus community, but I think that these communities, cross major conditions and into really all chronic diseases. So I think that it doesn't have to be limited to someone with the exact same diagnosis as you.
How can we connect with you to find out more about lupus?
So I'm on multiple platforms. I'm on Instagram, and I'm at the Lupus Doc, TheLupusDoc. I am also on Twitter, and it's my first name and last name. So Micaela Bayard, MicaelaBayard. And both these sites have links to my own website as well, where I've put some articles that I've worked on and kind of provide some links for other ways to connect to me. But I'm definitely always posting content on Instagram about things that have struck me recently in news or media, or great resources that I've come across for people to access. This week is actually the American College of Rheumatology's annual meeting, so I'm definitely going to be trying to post some content from what comes out from the meetings. And much of the information on my Instagram account is also on my Twitter account as well.
Wonderful. I look forward to hearing about your reflections on the annual meeting, and looking forward to connecting more with you on your social media, which is how we met.
The power of social media.
Yes, and the power of community. So thank you so much for joining us today.
Thank you for having me, Dr. Marian. I'm so happy we connected. I hope we do this again.
Definitely. Thank you for listening to this episode of the Sisterhood of Limitless Living podcast, Season 2. Hope you enjoyed the episode. Look forward to having you join us in upcoming episodes as well, where we continue to talk about integrative wellness and autoimmune living our best lives, being our own best advocates. Feel free to subscribe on iTunes to the podcast, and we are also available on several other locations as well. For more information about Dr. April Moreno, you can visit aprilmorenophd.com. Take care.